Hello. The purpose of this movie is to explain the EduMod program for teaching and testing radiation oncology skills. I am Bob Amder, the Director of Education for the company, Radonki Learning Center. The senior partners of this company are Scott Kaler and Art Boyer, who have developed several innovative e-learning programs related to radiation oncology, with the most recent being the EduCase software that is being used in contouring courses at the major radiation oncology meetings. The idea behind the EduMod program is to use the EduCase software and other education tools to create a web-based program with education modules, hence the name EduMod, that both teach and test radiation oncology skills in a way that is more effective and more efficient than other options. The main deficiency in our current education programs is that they are based on passive learning and testing that does not involve doing real work tasks. What all adult education programs need, especially those related to technical skills, are programs that contain these three elements. Simulated work, meaning that we learn technical skills best by actually doing them in a situation that reproduces the real work environment. In radiation oncology, this requires innovative software because it's not possible to do even the most basic treatment planning tasks with conventional education tools. Repetitive practice must be part of the instruction program because it's not possible to master technical skills without repetition. And the examinations must reproduce real-work tasks so that passing the examination and demonstrating mastery of a technical skill are the same behavior. The EduMod program removes many of the obstacles to progress in radiation oncology education and competency assessment by creating a web portal where authors use proprietary software to create education modules that first explain expert guidelines or opinions with a rehearsed presentation made with high-quality video and audio recordings. Then the author leads the user through practice sessions where they get almost instant visual and quantitative feedback on how their work compares to the expert reference. After completing the practice sessions, the user is tested with tasks that are identical to the activity that they'll perform when they are making decisions in their practice. The program is designed with a production process that allows authors to create their modules with almost no professional assistance and to keep their modules up to date with frequent revisions. And, especially important for professional competency assessment, is the ability to evaluate and store individual and group results with protection of confidentiality. There's no substitute for working with an EduMod online yourself, but you'll get a good feel for the program from my demonstration. This is what the browser window looks like. It has this green header bar which has the EduCase logo in the upper left corner. In the large central area of the home window is a screen that shows the title of the module that the user has selected and two images, one that shows something related to the topic of the module and the other is a face shot of the module author with their name underneath. The information in this window is different for each module. At the bottom of the home window is the information area that's organized in three columns. I'm going to magnify the information area so that you can see it better in this movie. The first column from the left lists the modules that the user has access to. After we build the module library, this list will be long for many users, but for this demonstration there are only two modules: Introduction to Nodal Stations of the Head and Neck, and Contouring the Level 1 Nodal Station. In this example, I have clicked on the Contouring the Level 1 Nodal Station, so the text is brighter than for the other title. The second column is labeled Lessons, and this column shows the different sections of the module. We require that each module have the same basic format, so this section list will be similar for all modules. I'll go through these sections in the rest of this movie. The last column is labeled Progress, and it has things like a color bar that show you how far you have to go time-wise to complete the sections with timed recordings. And these circles on the far right change from red to green when the user has successfully completed a section of the module. These PDF icons show that these sections of the module contain a document in PDF format for download. I'll now go through the different module sections. In every module, the first section is called Lesson Introduction, and it is simply the single screen that you are now looking at that shows the module title, an image from the module, and the author. The next section is an overview lecture. To launch the lecture, the user simply clicks over the words Overview Lecture. Here's a clip from the overview lecture from this module. Hello, I am Bob Amdur, and the title of this module is Contouring the Level 1 Nodal Station. The learning objective for this module is to develop the ability to contour the Level 1 nodal stations on axial CT images as would be done for radiotherapy planning. I'm now going to jump ahead in the lecture to where I'm explaining the boundaries of the Level 1A station on a lateral CT scout film. Now let's look at the boundaries of the Level 1A nodes, or the submental nodes. The most anterior boundary is the inner surface of the mandible right in the midline, or the platysma muscle as you go a little inferiorly. Then this anterior boundary is the platysma muscle just under the skin. The most inferior extent of Level 1A is the level of the superior edge of the body of the hyoid bone. This posterior surface is defined by the floor of mouth muscles. In every module, the overview lecture includes a demonstration of the skills that are the topic of the lecture. How these skills are demonstrated depends on the nature of the topic. Here's a clip from the demonstration portion of the overview lecture from a module about contouring the Level 1 nodes. I like to start the contouring at a level like this, near the middle of the submandibular gland in the superior-inferior direction. For the sake of time, I'm not going to actually draw the contour lines during this demonstration. I've done that previously, and I'm going to click on this Authors All button, and that displays the contours that I've drawn. This green line is the Level 1B nodal station on the left, and the key boundary definitions are medial edge of the submandibular gland, posterior edge of the submandibular gland, and at this level you extend the contour out to meet the platysma muscle. The platysma muscle is this thin gray stripe that you see just below the skin. You see it nicely on the other side where I don't have the contour. You go out to platysma and then up platysma and then hug the medial edge of the mandible. You then hug the lateral edge of the anterior belly of the digastric and meet up with the contour along the medial border of submandibular gland. The next section in the module is called Practice Case, or just Practice. And this is where the author has prepared image sets or images and questions, or whatever is appropriate to make it so the user can practice the concepts and skills that were taught in the lecture. There is no time limit in this section, but learners must complete all the practice exercises to move on to the next section of the module. Learners get feedback on their performance in this section by checking their work against the author's answers, and the learner controls when this happens. Here is a clip from a practice session where the task is contouring. This is the practice session for the module Contouring the Level 1 Nodal Station. The idea is for you to practice contouring the Level 1A and B stations, and then if you'd like to compare them to my contours. In this module, I've only contoured on the left side of the patient's body, but you're welcome to practice contouring on both sides. So the way you would do it is first be sure that my contours are turned off in the author structure section, and then go down to the practice structure section here, and you would click on either 1A or 1B depending on which station you wanted to start practicing. I'm clicking on level 1B here, pretending to be you. You then want to be sure that you've selected that structure in the region of interest menu up here. Then we activate the window. I'm going to select the continuous contouring tool, and you would contour what you think is the level 1B station in this case on the left, and of course move up and down as you think necessary to contour correctly. I'll just do these 2 levels. Then if you'd like to check your contours against mine, you would turn on my contours here, and you can see that in this case my contours are the same color as yours, so it makes it difficult to compare. I find it useful to click on the color bar and change the author contours to another color, in this case red, and then you can see the difference between the contours that you've drawn and what I thought was the correct answer. In this case they look pretty close, so I did a good job of repeating what I think should be done. Good luck with this practice session. That's it. And here's a clip from the practice session of a module that teaches CT anatomy of the head and neck. This is the practice session for this module. The format for this session is that I will first present you with the unknowns to identify, and then I will explain the answers. Take as much time as you want to think about your answers. The video will not advance beyond the image with the unknowns until you click on this resume box in the bottom right corner of the screen. Identify the labeled structures. Click the resume box when you are ready to hear me explain the answers. So at this point the learner would take as much time as they need to review these images. On the right is an image with numbered structures to identify, 1 through 7, and next to it is the same image without the numbers and arrows, because sometimes the numbers and arrows obscure the image and make it more difficult to tell what's going on. So the learner would take as much time as they need, and then when they're ready they would move their mouse over this resume button and click it, as I'm going to do now. Structure 1 is the ascending ramus of the mandible. 2 is the masseter muscle. 3 is the parotid gland. And then structures 4 through 7 are what I call the 4 white spots medial to the parotid. It's really useful to learn these 4 structures because there's a lot of important anatomy happening in this area, and these structures can look very different between patients, and they're often asymmetric from one side to the other in a given patient. Structure number 4 is the retromandibular vein. 5 is the internal jugular vein. 6 is the internal carotid artery, and 7 is the styloid process, which you may not see at all because it's only a few millimeters long in some patients.